In this lesson, we're going to focus on the nurse-patient relationship. And first off, I want to remind you guys of something. You're working really, really hard and you're focusing on your skills and your concepts and your tasks. And sometimes we become so focused on that, we actually forget that our patients are human, right? Your patients aren't this mannequin in a hospital bed. They're people. They're someone's daughter or brother or mother or wife, spouse, an aunt, a grandparent. They're all people, and I really, really want to hone in on that idea. And one way we can do this is focusing on humanization. So when I say humanization, what I mean is removing this idea that a disease is defining. So for your patient that has schizophrenia, you would say it's a patient with schizophrenia versus saying it's a schizophrenic patient. You always do this. So like if you had a patient with colitis, you would say my patient is a patient with colitis, not a colitis patient. You also want to remove any bias. You're going to get the nurse that had a bad night or a bad day, they had a bad shift, whatever it is, and they have this perception of what the patient, of who the patient is. And when they say, oh, the patient was just terrible, then you kind of have this idea that, oh, I'm going to have a really, really crappy day. And that's just not the truth. So what you need to do is remove the bias that you have and check your attitude at the door, meaning that, hey, everybody gets a clean slate. The beginning of the shift, everybody starts out fresh, new eyes, new energy. So when you do this, it also helps to remember that your patients are human patients and they still have needs. So if that patient was really painful, was there something that the other nurse missed? Is there some way that you can actually kind of recover from this and maybe identify it? So this is why you need to remove that bias and check your attitude. Another way that we help to foster this relationship is by building trust, and we can do that with communication, and we can be honest and we can be faithful with our patients. So if we tell them we're going to be gone for 5 minutes to get their pain medication, we need to make sure that we're gone for 5 minutes. We come back with their pain medication because we've told them we're going to be gone for 5 minutes and we're coming with something to help them. When you do this, you help to build that trust and you're already winning them over. Another way that we can focus on fostering the nurse-patient relationship is through this idea of sympathy and empathy. And I had a communications professor in college tell me there's a really, really big difference between sympathy and empathy. Sympathy is saying, I feel for you. Whereas when you say that you have empathy, I'm feeling with you. One of the cool things that I was part of when I worked in the surgical trauma ICU is that, well, we often got these transplant patients. And what would happen is you have to basically keep them alive, right? So you have to do drips and you have to, they may be on pressors and they have all these little nuances to keep the tissue as optimal as possible for whatever patient is going to receive those organs or that tissue. And you really get involved with the family and you start to become kind of engulfed in this idea of who they were, and then the family tells you all these stories about the patient, what they did and who they were and all these great qualities, and you essentially become part of the family. And when you do, that gave me a really good insight, and it gave me really good insight into what empathy actually was, because I was able to feel with them. So I became moved by what they were doing and what I was doing and who that person was. And we don't always feel what our patients are going to feel, but if you can try to relate to them, it gives you maybe a better perspective so that you can empathize with them a little bit better. But it's really important that you know the difference between sympathy and empathy and when which is appropriate. All of the things that we're talking about today really focus on this concept. Building rapport. Rapport is this idea of building this relationship through trust. If your patient can trust you, they become more compliant. If they have to take like liquid potassium is awful. It's terrible. And it tastes gross, right? Gross. Oops. It's nobody likes to take it. But if your patient knows that you're going out of your way and that you are devoting all of your energy and all of your time into making sure that they're taken care of and you're building this relationship, they're going to be more compliant. The other thing you're going to do is you're going to garner more of their respect. You're going to earn it. And so that that's just going to show, and it's going to reiterate this idea of rapport. One really important thing that you have to focus on is having healthy boundaries with your patients. I know you love your job and I know that you love your patient, but you can't regard this concept of boundaries because it really has to do with safety. It has to do with your safety. I never had my last name on my ID badge. I never told any patients what my last name was because I felt that it would violate any potential safety issues that I had. I wanted to make sure that I was safe, that my family was safe. I don't know these people. I show up to the unit and I give my all to caring for them every day, but I have to make sure that I have healthy boundaries. And I'm not saying that patients are going to go out and do crazy things. But I do want you to understand that it's really important to have these boundaries, because the other thing is you could be violating hospital policy or HIPAA. So in order to keep everybody safe, the big thing is make sure you have healthy boundaries. Hey, this is appropriate. This is not. But when I was there, hey man, they got 100% of my effort every day. But I just made sure at the end of the day, I had safe boundaries with my patients. Since we've been talking about what we do to foster our relationship with our patients, let's see how it actually looks in practice. So your first phase is broken up into these 4 stages. Your first stage is pre-interaction stage. This is where you get your patient history. This is where you can review your patient chart. This gives you an idea of what the patient is. So you'll see prior medical history or surgical history. You'll see all of these things, and that kind of gives you an idea of what the patient is from a medical standpoint. And then you'll go into the orientation phase. And the orientation phase this is where you introduce yourself to your patient. And I want to give you a couple of tips here. First off, be genuine, be yourself. Don't fake who you are. And, if you're kind of a goofy person like me, walk in and be a little bit goofy. It's okay to show who you are. A lot of people are very intuitive and they can smell that fakeness from a mile away. So just go in, be general. I walked into some patient. I was generally casual with them. Hey, I'm your nurse. I'm going to be taking care of you today. And then there have been others that are just maybe they had a really rough night or they've been by themselves. I'll pull in a chair and I'll kick it with them and say, hey, I'm your nurse. I'm going to be taking care of you today. What can I help you with? And when I started my day off like that, it showed them that I gave a damn about what I was doing. We were able to be on this journey for the next 12 hours. And we were there to kick ass. That's what we did. So you plan your goals for your patient during this stage. You can say, okay, we're going to really work on your pain. We're going to get you out of bed. We're going to talk to physical therapy. We're going to talk to your doctors. And I kind of set their expectations in this phase. That way we kind of knew what we were going to be working against. And then you've got your working phase. And your working phase is where you go and you're really putting into place what you've talked about here in the orientation phase. Hey, you can't go home on injectable pain meds, right? So we want to switch you to oral pain meds. And we're going to try it out. We're going to see if this one works. And if it doesn't, you've got your injectable pain medications that we give, but we really want to transition you over to your oral pain medications so that you can go home and you have a way to control your pain. And you really focus on continuing to work towards those goals in the working phase. The last part is called termination. This is really important. This is part of setting up those safe boundaries. I always let them know when I was going to be leaving. Hey, I've got 5 hours left. I've got 2 hours left. And before I leave and the new nurse comes in to take care of you, I want to make sure that we do X, Y, and Z. And so it helps to reinforce those boundaries and also helps to really keep your patient oriented. It's one of those little tricks that you can use to be like, oh, hey, it's the afternoon and I'm going to do this because at 7 o'clock, which is in 2 hours, the new nurse is going to come on. And by doing that, it helps to, reinforce reality, and orient them. And the other thing it does is it helps to really, really establish those. And then when your shift is over, this is a big thing that I really did. Thank your patient. At the end of the day, your patient you have no right to walk into the patient and just automatically care for them. There's this acceptance of, hey, I'm allowing you to take care of me. So understand that from your patient's perspective and thank your patient. Hey, I appreciated working with you. Thanks for letting me do that. I really appreciate it. I'm glad you had a great day. These are things that you can do to really help to foster that relationship and build trust. So let's say if you're back the next day and you want to take that same patient because your patient made a lot of progress, guess what? You don't have to start back here, right? You don't have to go back and have to earn their trust. You're already back in this kind of orientation and working stage. Hey, we're going to do this today. We're going to do this today. And another day of kicking ass, right? So that's where we got to go. Today for our nursing concepts, we really wanted to drive home the idea of professionalism and building your interpersonal relationships with your patients. And also we really, really wanted to focus on communicating with our patients and building up your trust. All right, so let's recap. First off, don't forget that your patients are humans. Don't compartmentalize them. Don't make them tasks. Don't make them skills. They are people. They're your aunts, uncles, grandmas. They're people, and they're people with identities. And also be sure not to make their disease or illness part of their identity. They are patients with something, right? So don't compartmentalize. Work on building trust. Do this through fidelity and veracity. So faithfulness and honesty. We want to make sure that that we are staying faithful to our patients. We are being honest. If it takes you 5 minutes to go get 5 minutes to go get those medications, go do that. 5 minutes and be back. Empathize. Feel with your patient. You want to make sure that you're connecting with them. Focus on building rapport. Rapport builds compliance. It helps you to have them you earn their respect, and you also get them to have more positive patient outcomes because they are being compliant. Also, remember to establish your healthy boundaries and stick with them. These are the things that are going to keep you safe. You don't want to give your patients false pretenses or do anything that violates policy. So that's our lesson on building the nurse-patient relationship. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.